So, hello everyone. We are live now, and I'm going to continue my session on OET Speaking, which we have been doing. And this is actually an all-star session. So, if you're able to watch me and listen to me, please type in the chat box. That would be very helpful for me to make sure that we are live and up and running. All right. So, are you able to? Yes. Please type in your message. So we are going to look at how to elicit and explore the patient's perspective. And I'd like to know if you can listen to me. Yes, I'm just waiting for the comments. Here we go. Hello, good evening. Right. So to begin with, I want you to let me know what you mean by elicit and explore, because that's what we are doing. Right. In the chat box, I want you to type what you understand by the word elicit. Okay. And also what do you mean by explore? Because once we know what the meaning of these words, it's going to be a big help in understanding what is eliciting and exploring the patient's perspective. So here we go. Right. Okay. So because this was not planned to be a YouTube live, some of you are yet to join, but I'll try to share it later with all of you. All right. So I want to discuss a few things, and then we'll discuss what is elicit and explore um, as we go. But here are some hard-hitting facts. Now, between 30% and 80% of patients' expectations are not met in routine primary care visits. Now, this is a very serious concern. Now, this is based on studies across the developed world primarily, but this should drive hard how important it is that we learn, healthcare professionals learn how to elicit and explore the patient's perspective. So on with that, one of the reasons is the inability of health professionals to understand the patient's perspective. That's a worrying fact indeed, because that is something that should happen at the onset of a consultation, and it should be the key to patient's care. So if you're able to understand the patient's perspective, then it's going to help you improve your skills in patient-centered care. And it's also going to improve your OET test score. So When we look at developing this skill or a set of skills, please don't look at it just from a test point of view, from the OET exam point of view. Think of it as skills you need every day at work. Let's look at this. Now, this is the patient side. They share their perspectives on their own. Every person will have their own ideas and perspectives and thoughts. So this could come as statements and sometimes as cues. So by cue, I mean a signal. At the same time, patients will also respond to your questions, to your queries. So that happens as well. Now, health professionals. Now, this is where it gets problematic. Often redirect patients' initial description of their concerns. Either they're not allowed to complete it, or their later rising concerns aren't taken into account. And quite often, these leads to missed opportunities to gather data which the patient might need. All right. So that is what is alarming, something which we should be worried about. So as I said, often it redirects patients' initial descriptions of their concerns, and that's basically similar to an interruption, or it is equal to an interruption. So you might be interrupting your patient, which is not good. So eliciting the patient's perspective is a key aspect of cross-cultural understanding. So I did mention about, ask you about elicit and explore. So elicit is to draw out information, to ask, to bring it out, especially something which they're not overtly telling you. All right. And exploring is also finding out a bit more detail at a more elaborate level. So knowing this is very important. And again, without asking, providers are guided by their own assumptions. Now, there is a big problem because health professionals assume that this is what is going on in the patient's mind or whatever. Since assumptions are based on generalities and stereotypes, they could be wrong. So I'm going to give you an example so that you learn it with the help of examples. I love telling you stories and examples and illustrations. So we're going to look at two people, a couple, partners, Ken and Ella. Ken has survived a stroke and is about to start his rehabilitation. As you see in the picture, he's a bit worried. Ella, his partner, is concerned about his recovery and the success of rehab. So this is interesting because you're going to look at the perspectives of these two people and also of the health professional. And remember, in your OET speaking, you might be talking to the patient themselves or a carer. So I've covered both. Okay, so Ken's perspective is about his stroke, how he's going to fare. Is he going to be able to return to the kind of activities that he used to? Look at Ella. She's concerned about his recovery and the success of the rehab. But that's not it. There's something else as well. There's also something called caregiver burden, because any carer themselves would be going through a lot of difficulties, perhaps health problems, emotional problems, and it's on top of that usually they might have to care for someone. So and quite often it is not covered much by the health professionals. It isn't discussed as much. So let's look at what's going on in their heads and see how you can improve the finding out, the eliciting of their perspective, their thoughts, their ideas, their expectations. Now, if you remember, if you are an OET student, you must be aware of the criterion of eliciting, understanding, and incorporating the patient's perspective, which is something that this session is covering in detail. So let's look at Ken. So he thinks he has no clue about the rehab. And that's his idea. He doesn't have an idea, to be honest. And his feelings, he thinks it's awful. He has always been able to walk on his own, and now he is unable to. So that's worrying him. What's the next thing that's bothering him? His thought. He's thinking that the health professional will help him to walk a bit. And his concerns. He is worried if it's going to be painful. So let's look at a conversation as it unfolds and see where we can improve. So the health professional could be a nurse, could be anyone. Hey Ken, we're going to start your rehab. Are you ready? Do you think he's ready? No. He says, I feel awful. And look at the response. I'm sure you will feel better once we get started. And he says, okay. But the health professional hasn't addressed his concern. So that's not quite good. It's not something which is appreciable. So the health professional in this case failed to elicit the patient's perspective, absence of patient-centered communication. And it may affect the OET score in clinical communication as well. So there's a big problem there. How can we address it? How can you improve? Think what could have been done differently. You can type in the chat box. Okay, so let's see what could be done. We did go through it. But instead of telling Ken that he'll be fine after the rehab starts, here the nurse is taking a different stand. Can you imagine that? Can you tell me specifically what makes you feel so? So that's where she is trying to elicit, which is a very good thing. So here we go further. And Ken says his future looks bleak. So that's his response. And it's not something that can be brushed under the carpet. Now, the nurse says, that's the whole point of the rehab. I'll touch on that later. Is there anything else? So she's hinting that rehab will improve his situation. And if he thinks it's going to be bleak, rehab is something that's going to turn it around. Now he's asking, will it be painful? So she says, I'll keep checking on your pain and stop it if it hurts. So Ken should be a bit more relieved and relaxed by now. Yeah. So he says, that would be great. Now you have someone who is a little bit more ready mentally, emotionally to get started with the rehab. And the reason is that the health professional did go through their feelings, thoughts, ideas, elicit them, and try to incorporate it in the treatment, give responses that address it. Okay, so now we are going to look at the carer, the partner, Ella. So what will you ask or tell Ella to explore her perspective and reduce her carer burden? Can you type in your responses? So this is what she feels. She feels tired. She says, I can't eat properly too. She's not sure what's going to happen or what the health professional, the nurse, is going to do. She thinks that she can connect with other carers who have similar experience. And she's concerned that she hasn't monitored her blood sugar levels. So it seems she's going through a hard time. She herself is diabetic, but because she has to care for her partner, she has not been able to take care of her own health. So that's a big concern that she has. And as we saw earlier, it's something that's called carer burden. Yeah, look at that, the effect on her life. She may have to resign from her job and take over the farm because Ken is a farmer. So there's a lot going on at the moment in the minds of both Ken and Ella. And her expectation, will he regain his health? That's what she expects. Right. So this session, as a number of OET All-Stars from IRS Group, he's from IRS Group. And if you would like to join us for your OET preparation, you're most welcome. You can contact our student counselors on the telephone numbers. These are Indian numbers, on WhatsApp or over the phone. You can go to our websites and enroll for a course that is appropriate for you. Your teachers will guide you. Our counselors will guide you as well with the right course. So now that you have understood how important it is for you, both in the OET speaking and in healthcare, to elicit and explore the patient's perspective, their thoughts, their ideas, I'm just going to share a couple of questions which might be helpful for you. If you're an OET student, I don't want you to memorize this. These are just examples for you to go through. What do you think is wrong? What do you think has caused the problem? What are you afraid? What are you afraid this might be? Tell me more about your anxiety or your fears. Tell me what the pain was like before, this happened. What have you done to relieve the problem? Have you tried any treatments? Have you seen other healthcare professionals? Is there something else that you did for this? What do you think would help you? How can I help you with this? What do you think about what I have recommended? Do you think it will help? What problems do you see in doing it? Who will help you make a decision? Do you want me to talk with those people? Is there something else that is bothering you? It seems you have something to tell me. Is there anything else that you'd like to talk about? What else are you concerned about? So, interesting questions and statements which you can use to elicit their perspective. So to practice this, I've got a role play card as always. How can you elicit this patient's perspectives? Let's try it out. In the chat box, you can post your comments. So you see it's a surgeon's clinic. A patient with a body weight of 170 kilograms who is scheduled for a bariatric surgery has come for the pre-op consultation. The patient is anxious about starting the special diet and possible complications. The task: find out how she feels about the surgery. And then you have to explain that very low energy diet includes meal replacement products and is easy to follow. Reassure the patient that the results from the screening test have been evaluated and the chances of complications are negligible, and that all precautions will be taken. So there's a lot of scope, opportunity for you to elicit and explore the patient's perspective in this, how you can understand that. So if you've done role plays with a setting similar to this, or if you work in a surgical ward, or you see a lot of patients across the spectrum where they have a lot of anxieties before a procedure. So your duty is not just to explain the procedure as such, but to pull out what is going on in their mind, in their heads before the procedure, and make them as comfortable as you can. Okay, so let's look at some imaginary situations. So the first bullet says, find out how he or she feels about the surgery. And if they say that they're really scared, instead of brushing under the carpet their fear, which is dismissal, you have to explore what is that fear. Bring it on. So you can perhaps say something like, can imagine that you must be really scared before the surgery, and you told me it's the first time you are undergoing an operation. Can you tell me a bit more about the fear? What exactly makes you scared? So that is eliciting. And then they will tell you that they are worried about complications, about they have heard people die during an operation, about having scars. you know, how long they have to be in the hospital, about sedation, lots of things. And then they will tell that. But for that to happen, you should create an ambience, an atmosphere where that's open. They're welcome. They might tell if the surgeon exactly does it right. Will something go wrong? Because people hear more of stories of that are scary. Something went wrong in a surgery, rather than, you know, thousands of successful, absolutely perfect surgeries. So you have to elicit it, and then that will be that helps the patient a lot in facing the surgery with confidence. Now, the second one is about a specific diet, meal replacement, which they have to be on. So any patient would have had a very normal diet, or, you know, any sort of diet. When they are told that they'll have to change their diet, when you're implementing a new diet plan, they'll have a lot of thoughts going on in their heads, which again is something for you to understand what is bothering them, and then try to bring it out, and then you can connect your explanations with that. So that's how you become successful in your clinical communication, at work, in OET speaking test, and, you know, be great communicators. So at IRS Group, we want you to be great healthcare communicators. That's the reason why OET Official is conducting these sessions with partnered with all the All Stars premium preparation providers from across the globe. So try to do it in your OET speaking, and you will see a huge improvement. So if you've got any questions, it's question time. So thank you for watching this, and if you are again watching it later, you can still post your comments in the chat box. This was scheduled for Facebook Live, but we just had to change it initially to this YouTube Live, which will later be uploaded on OET Official's Facebook page as well. So thank you everyone for watching this, joining, and I hope you will improve your speaking skills tremendously. Thank you very much.